back to another enlightening episode of The Truth About the Plant, the show that takes you on a journey through the world of psychoactive plants and alternative wellness, all while delivering real, actionable insights you crave. I'm your host, Christina Dees, and this is my equally talented co-host, Dr. Amanda Ryman. And Dr. Ryman, you get to tell everyone why we're here.
Well, thanks, Christina. So we're here because it can be so difficult to find good, reliable information about cannabis on the internet. You may have a pressing question, one that can impact your health and well-being or that of those you love. You Google it and you get 100 different answers, many times completely contradicting each other. So how do you know the truth? Well, that's where we come in. We're here to give you the science-backed, actionable information about cannabis that you need so you can get the information and get on with your day and develop that healthy, balanced relationship with our favorite plant. So you can think of us as your kick-ass granddaughters or your really cool aunties, the women in your life who will always tell you the truth.
And bring you some really good, knowledgeable episodes. And today, we're thrilled to be joined by Melanie Winsell, all the way from Australia, where medical cannabis is already making waves in the healthcare system. And as a pioneer in cannabis and healthcare integration, Melanie's here to help us tackle the big question: how do we seamlessly bring cannabis into healthcare? So from patient care to policy, this conversation will explore how Australia is leading the way and what the rest of the world can learn. So buckle up, we're diving deep into how this powerful plant is reshaping modern medicine. Melanie, welcome to the show.
Thank you so much. I'm absolutely delighted to be here in such good company.
Yes, and it's very early in the morning in Australia, so we just want to give you an extra thank you for getting up early to make this happen and connect with our viewers. I'd just love for you to give a brief background about yourself, and then we can go into our question.
Yeah, absolutely. So my name is Melanie Winsell. I'm a healthcare strategist who specializes in the medical cannabis industry. I work in Australia, also in the US and the UK, and I have a dual role, really. So I'm full-time employed by a cannabis company as their healthcare strategist, working with relationship building with mainstream public healthcare in Australia, which is so important for system integration. I also do some consulting, and I'm also an author, and I'm the author of the book Cannabis Queens.
Great. Thanks again for joining us and bringing your knowledge here. So what are your thoughts on how we can integrate cannabis into healthcare?
This is the most exciting question for me, because these are the conversations that we need to be having, and not just within our cannabis bubble, actually within the broader healthcare bubble, and let's pop that bubble wide open and have these conversations more globally, which I think is really important. And you know, I acknowledge you for your work in doing that, because change does not occur in a vacuum. There's a lot to consider. And change does not occur quickly. And change, like growth, think about awkward teenagers, actually isn't pretty. It's not sexy, it's not easy, it's not fun. It's actually really hard work. And it's even harder when we're talking about an established healthcare system. So to help answer this question, I want to look at 3 different markets today. So I'll talk about the Australian market and how we're implementing medical cannabis. I'm also going to do a comparison to the US market, or the 51 sub-markets in the US, not all 51. We'll speak broadly. And then also the United Kingdom, and have a look at where we are. But I thought I would start by actually looking at defining healthcare versus healthcare, because I think that's a really important place to begin. Healthcare, one word, refers to a healthcare system. The public health system, private health system, anything that is a systemic approach to healthcare, where there are multiple players, the health ecosystem, that's one word, health system. Healthcare, 2 words, is actually the individual acts that we do to care for health, our own or someone else's. So a doctor works in the healthcare, one word system, but they deliver healthcare to patients. So for today, the question that I'm delighted to be able to probably not answer for the world, but certainly to contribute, you know, from my experience, is how do we meaningfully and appropriately and safely, with room for innovation, implement cannabis into mainstream healthcare systems.
Excellent.
It's kind of a new concept, right? Because actually medical cannabis or medical marijuana in the States, and I'm using these quotes because, again, let me define early, cannabis is a plant. It's not a drug. It is a plant that can be used for medicinal purposes, for its therapeutic value, but also it can be used as a drug in a euphoria seeking context. And my personal politics are that's absolutely okay where it's legal, and safe and appropriate. No problem. In terms of, cannabis as a medicine, cannabis as a medicine has existed for nearly 5,000 years. Okay. I'm sure lots of your listeners will know that or be aware of it, but let me give you a couple of super quick highlights. Emperor Shen Nung, the original pharmacopoeia of Chinese medicine, the first recorded evidence of cannabis as a medicine. That was 4,870 something years ago. By the time the Controlled Substances Act, and I defer to the US here because it's the oldest and most established medical cannabis market, the Controlled Substances Act came in 1970, classifying cannabis as a drug with no therapeutic value, no medical value. So the fight really began in 1970 because prior to that, we had thriving cannabis, thriving hemp systems all around the world for millennia. So in fact, by the time 1970 came around, the Controlled Substances Act, actually cannabis had been registered as an ingredient in over 2,000 patented over-the-counter medicines like Tylenol or aspirin or Nurofen. 2,000 different medicines contained cannabis that you could purchase over the counter at the pharmacy. Now, in 1970, that changed, and it's taken a very long time to progress medical markets because of this. So in the history of cannabis, 99% of that time, cannabis was considered medical, medicinal, for wellness, for food. The last 1%, the last 50 years of that time, the time we're living in, is the age of prohibition. And so the people who understand the medical value of cannabis are really fighting now in this. We've had 99% of a great time with understanding this and understanding our bodies and understanding the position of cannabis as a plant in lives. And this last 1% of time, we really have to fight. And so by integrating cannabis into existing medical systems, it's going to be the most effective way to do that. So I thought we would have a quick look at the US versus the UK versus Australia and where they're at. Mm-hmm. So in the US, the first medical cannabis market that opened up, and this is where we talk about cannabis as a part of the medical system, was 28 years ago. In the UK, it was only 6 years ago. And in Australia, only 8 years ago. The UK and Australia do not have adult use markets, do not have recreational use for cannabis. In fact, it's very much considered under the alcohol and other drug legal framework. So medical cannabis, we're just trying to push in at the edge, to find our space. In the US, where there's an adult use market that thrives, 4 years ago, there was an equal balance of medically licensed patients in the US versus adult use patients. Now, we've seen over the past 4 years, that's the most recent data, over the past 4 years, we've seen recreational adult use explode in the US because of the great innovation that's occurring in industry. But if we think about the medical, that's really not moving as fast. And I think it's important to understand why. In terms of implementing into health systems in the US, the only point that a cannabis patient touches the healthcare system is when their doctor writes a recommendation. They are then thrust into a commercially driven retail system. So there's really only that one medical touch point. Now, there's 2 states where a pharmacist has to dispense, but only 2 out of 51 markets. In Australia, it is built into the medical system, but we have low adoption rates by medicos. So only 5% of people who can prescribe cannabis in Australia prescribe after 8 years. And there's reasons for that. There's barriers. In the UK, in my opinion, it's the most likely to succeed as a medical model because they have deeply integrated it by making it so that only specialists who are a part of a multidisciplinary team with 2 medicos signing off can prescribe. So each market is taking a different approach. And there are features and benefits of both that work and don't work. And so our journey is to kind of share those learnings and go on that together. And really, ultimately, at the end of the day, medical cannabis is about patients, and it's about a whole spectrum of patients, right from babies with intractable seizures who require full spectrum cannabis oil to survive. They're up to 500 seizures a month, all the way through to a high performing professional with ADHD who cannot turn her brain off at night and needs to wind down in order to have quality sleep. And that last example is actually me. So I'm as valid of a medical patient as these other babies, but the babies, the flower children, I call them, are so impactful in changing the narrative because it's so different to what people perceive a cannabis consumer to be. So there's some system enablers and barriers that come into play. Some of the enablers that are either enabling us now or will in the future are the indisputable safety profile of cannabis. Not a single death attributed worldwide directly to cannabis ever in 5,000 years. Medical education will be an incredible enabler. Now, that's not built into the health systems yet in any of those regions. There's not one university. Well, there are some side courses, but mainstream medical practice, no. Good prescribing protocols, which come out of research, will be a massive enabler. Patient education, which currently does not exist in the formal medical market, so is coming from legacy. So it's kind of grassroots education that patients are receiving. Medicos don't like. And quality standards for it is really important as well. So just understanding what is good product, what is safe for consumers. And I think in terms of operationally getting those medicines to market, Australia does it well, the UK does it well, the US does it well. So I think in terms of getting products to market, we're doing well. But once those medicines are in market, how do we get them prescribed? How do we tell patients about it? And there's a lot of restriction around that. Some of the barriers, legal reform is very slow, very slow. And is kind of the power for that is held by a few decision makers who are typically older and less open. So that's slow. Systemic reform is slow. Even to integrate the concept of person-centered care into mainstream healthcare, academics in Australia have been working on that for 15 years, and it's only now kind of embedded. Imagine what the thought of cannabis does, in terms of a time frame. There's a perceived lack of research. I would suggest that there's plenty of research. It's just that there's so much variability with cannabis because it's a plant and because there's so many formulations and because it treats so many different conditions and symptoms that we're going to need 500 times more research on cannabis than we would on any other drug for it to be deemed enough. And then there's a lack of experienced talent. So there are some amazing, amazing people in the cannabis industry worldwide, but some of us have only been doing it for 2 years, 6 years, 8 years. So we really need to come together and learn, and there's not enough of that knowledge sharing that happens globally. So how do we integrate cannabis into healthcare? Look, there's really no one answer, and it's a lifetime of work. But it does start with one conversation with your doctor, one conversation with a peer, read one article, highlight someone who's doing the work. We really need a catalyst, but then we need to engage really quality, established, evidence-based change management principles, co-creation frameworks, user-centered design, the model for improvement, plan, do, study, act, run pilot programs. All of that is very familiar language to mainstream healthcare. So we need to speak their language and do it their way, but we need to do it for cannabis, which does not fit in the established research and pharma model. So there's plenty of work to do, but it does start with one.
Well, thank you for that. So much great insight there. And I do agree that when we hear politicians, especially in the US, say that they've changed their mind on this issue, it's never because they read a research study. It's because they talked to a patient or they found someone in their life who was helped by medical cannabis, and seeing that experience of that person that they care about has changed their mind. And so you can't underestimate the value and magnitude of personal stories, around this issue. And I also really love how you were talking about the healthcare system processes and lingo. Cannabis has always been looked at as this kind of like outside entity to the healthcare. And I think you're so right that if we really want to integrate it, we have to start using the language and the processes that the healthcare, one word, system uses, because they know what to do. They know how to integrate new therapies. It's not that new therapies and new drugs and new things don't come along. It's just that they follow that path, and it makes people in the system feel comfortable. A lot of doctors I've talked to say, well, yeah, I think medical cannabis is probably a thing, but I don't know how to dose. I don't know how to, tell my patient how much to use. I don't know the products in the dispensary. I don't want to give them a recommendation or a suggestion that's going to end up with them having harm or having a bad time. So I think integrating the use of cannabis as a medicine with the way we talk about medicine, rather than expect it to be this exception that is accepted by the system but still lives outside the system. And again, I'll go back, I'm going to say, Christina, that's why I love tinctures. That's why I love tinctures, because I feel like they are probably the closest we get to how people dose other medicines. They're formulas. They're basically compound medicines. There's a standardized dose. It's measured. It's not smoked. And I know a lot of doctors who have warmed up to tinctures a lot faster than edibles or certainly smoking, because they look at tincture as a form of medicine. So, Christina, do you have anything to add?
Well, I know we like to keep it around 15 minutes, so I won't add much because, again, we could go down this big rabbit hole. But I love that you brought up some of the barriers to the market. One, you were talking about how patients are like thrust into the medical market once they get a prescription. How do the patients choose the products? I mean, is that something that the doctors are doing there, or are they just sending them again to say, go pick something out? Do they break it down like tincture, edible, flower, or is it just up to the patient to choose?
I think a lot of Australian patients wish it was up to us to choose. We don't have that flexibility. It's very different. So, in fact, in Australia, there's 6,000 registered cannabis medicine, well, unapproved by the TGA, but registered cannabis medicines in Australia. 70% of cannabis medicine consumed in Australia is actually flower, followed by tinctures, and there's a rising profile of vapes coming up through the market, both isolates, resins, and rosins, which is beautiful to see, because actually one could argue that in fact a rosin or a resin, for example, is the closest model to pharmaceutical in terms of a drug, right? Because it's the extraction, it's the most pure, and certainly more than flour. So again, another thing that I think we're light years ahead of the general public or the general medicos on thinking about that. But in fact, the doctor prescribes the particular medicines. So in Australia, the onus is on cannabis companies and our medical science liaisons to educate doctors, because like everywhere else in the world, it's not integrated into university care curricula, I guess. And we can't advertise. So in Australia, you cannot advertise anything to do with cannabis at all in any way. The only pathway to educating doctors for cannabis companies is by going direct to doctors. Now, to direct doctors, because they are perceived and do have the expertise, the intelligence, and the experience to understand that cannabis has risk associated. And I personally, I don't like that. I think access to cannabis education should be for all, but we live in a regulated system. So you can say anything to a doctor, you can teach them about your product, you can do whatever. That's how cannabis companies are approaching doctors. Doctors then prescribe what they feel is the right medicine. So they might prescribe a T22 balanced flower for breakthrough pain for a novice medical patient, plus they'll prescribe a CBD low THC or a balanced oil for daytime for setting that baseline of pain coverage. We're talking about a pain patient here. And then they might prescribe a THC tincture or hopefully full spectrum, full flower for evening. So then you've got your baseline of coverage day and night, and you've got your flower for breakthrough. That's a pretty typical prescribing protocol schema in Australia. But the doctor dictates which products are prescribed, and the pharmacist cannot swap those products out, with some minor exceptions, even for out of stocks.
Yeah, that's
So
quite
actually,
different.
yeah, the doctors hold all the power in Australia, and therefore the onus is on them to be very knowledgeable. And it's a lot, which is why you can understand adoption is slow, because the healthcare system and doctors the world over are under a lot of pressure and have been forever, especially the past 5 years. So unless they really have an affinity for cannabis or a curiosity about it, it gets left by the wayside, which means patients are not getting prescribed.
Hmm.
Yeah, and it's quite different from the States, right? Because there's a lot of doctors in our medical system that have no knowledge of cannabis and actually do not want to prescribe cannabis because it's still illegal substance here. And I was going to say too, in Australia, it's illegal to drive while using cannabis, correct? So that's why the CBD, the low CBD or the low THC, high CBD formulation for daytime use is also in the prescription.
Yeah, that's right. And do let me, I must say as well, some patients only use CBD. So what I described is probably a fairly general pain patient in Australia. And that's just one prescribing protocol. But a lot of people are just on CBD, and some people only take CBD, isolates for that reason. Because yes, in fact, in Australia, if you have any detectable THC in your system at all, you will receive, without exception, a drug driving charge. It is a massive fine. You lose your license. You can be imprisoned for repeat offences for up to 9 months. And when you do apply a year later to get your license back, it's a restricted license, meaning you can't have any detectable alcohol in your system. So you're flagged as a drug user. But in fact, no, I'm just a medical cannabis patient. So there's a lot of work being done here to change that. But it's one of the examples of systemic reform. The laws that, state-based driving laws have to keep up with what's happening in medicine. And the march of progress is slow. And all of these forces are pulling in different directions. So it's incredibly dynamic, incredibly exciting. It's like the lead up to the Big Bang, where everyone hopefully gets it. but there's a lot of friction in the system. There's a lot of friction because of that.
Mm, so fascinating. Well, thank you so much again, Melanie, for coming on. We really appreciate learning about what's happening in Australia, learning more about what we can look to do in the US, and integrating cannabis into healthcare, one word, systems. I love that. I'm going to use that. And to make sure that the health care that we're giving people using cannabis is something that becomes institutionalized so that more people can have access and we can make sure that the system works for everyone. So, Christina, you want to take us out?
Yeah, well, as we wrap up this very insightful conversation with Melanie, it's clear that integrating cannabis into healthcare is a global discussion, and Australia clearly is at the forefront. So, if today's episode has sparked your curiosity about how cannabis could reshape patient care, remember remember that these questions are just the beginning. And if you've got questions of your own, please reach out to us. We always love hearing yours. And again, our YouTube channel has tons more educational stuff. So check out our YouTube channel. And as always, stay curious, stay informed, and don't hesitate to explore the many ways cannabis could play a role in healthcare. We'll see you next time.